So perhaps what we need to do is a little bit more like a roll call. Can you manage that for us?
I think Chelsea is in control of the muting, and I will let Chelsea control us, and she does that very well.
Well, I'm very, very good with that. Thank you. If you wouldn't mind starting that, that'd be great.
Dan, can I interject, please? Can I interject?
Yeah.
Dan? In lieu of that, if you look at your everyone button down at the chat, it shows everyone that's online except for those that may have a call-in, that it just says callers. So that could be our roll check and we can move on.
Whatever works. Okay.
However, we should probably do a roll call just for Chelsea to be able to make sure she knows exactly who's on the line.
Mm-hmm. Okay, Chelsea, would you do that for me?
Sure. I'm just going to write down the line. So, and if I call your name, please either say hey or just, like announce yourself in some form. Becky? GCACH? Becky's here? Great. I know Carol's here, but Carol?
I'm here, thank you.
Diane?
Here.
Lauren?
I'm here.
Ruben?
Present.
Great. Wes?
I'm here.
I know Brian's here. I'm going to skip the callers and come back to them. Dan Ferguson?
I am aware and here.
Great. Eric?
Present.
Great. Looks like we have field group here.
Yep, present. This is Kristen.
Kristen. Joel Chavez.
I'm here.
Hello. Jorge Rivera.
Jorge here.
Hello, Jorge. Julie Peterson.
Did you say Julie Peterson?
I did. Hi, Julie. Kendra?
Well,
hi, I'm here. I also have a new title. I don't know if you need that now or later.
What was that?
I said I have a new title. I don't know if you need that now to change things. Or
what's your new title?
I'm the Tri-Cities Director of Catholic Charities, so I got a promotion.
Oh, yay.
Congrats.
Thanks.
Congrats. Welcome, Director.
Yes.
Les Stolniker?
I'm here.
Loanne?
Here.
Madeline Carlson?
Hi, this is Madeline.
Hello. Mariana? All right. Nicole?
Here.
From Field Group?
Yeah, thank you.
Hello. Penny?
I'm here. This is Penny.
Hi, Penny. Rhonda?
Rhonda's here.
Ronnie?
Let me unmute myself. Yes, I'm present.
Hi, Ronnie. Sam?
Here. Good morning.
Good morning. Or good afternoon, actually. Sandra?
I'm here.
And then Victoria.
Hello.
Hi, Victoria.
I think Rachel
So it looks like we have a... I'm sorry?
Yeah, I'm here. Rachel's here.
Hi, Rachel. Oh, sorry. Did I skip her? Oh, no. So there's some callers. So if I didn't call you out, can you please announce yourself? Okay, Brian, I guess it's yours.
Okay, well, thank you for doing that. Does sound like we have a quorum, so we can proceed. So thank you very much. We always try to remember to take a look and be cognizant of our conflict of interest policy, and make sure that we do those things correctly. What else do we have? So I guess we can kind of jump into the agenda, right? See if I can find my way here. My goodness. I wonder if I turned off my, oh, there it is. Okay, attestation of conflict of interest. We do that. Please be cognizant of your self-dealing transaction policy as well. We would just present that for your review. Our consent, I guess we got to talk about the board minutes, right? So, has anybody had an opportunity to review our minutes from last month? Also a teleconference. And I would entertain a motion for approval unless somebody has changes to be made.
Sandra, I'll move to approve.
Excellent. Thank you, Sandra. Second.
This is Ronnie. I'll second.
Thank you. Second by Ronnie. Are there any questions or comments, additions or deletions to the minutes as they're presented today? Okay. Hearing none. Ask for those in favor of approval of these minutes, please say aye.
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 Anybody opposed? Okay, thank you very much. Motion carries. So the next little guy that we got in here is going to be our ACH reports and updates. Carol, do you want to kind of drive that a little bit?
Sure. We will just follow the normal process as Chelsea scrolls through each report. Those responsible for the content of the report can report out. So the first is just a little report out. Chelsea, can you put the screen down a little bit? Thank you. This is just an article that's talking about the $850,000 that we have sent out to our behavioral health internship and preceptorship recipients. That funding went out already. We've heard lots of really nice things from various agencies across the state. We've also sent this information out to all of our legislators, and we have legislators in District 8, 9, 13, 14, 15, and 16. And I've heard back from a couple legislators that they're really happy to see this internship exist in our community. We think it's going to be a very helpful program for our behavioral health agencies. And I don't know, Dan, if you wanted to add anything else given our conversations about behavioral health internships over the past month.
Just that there is a lot of interest at the state level, both with the behavioral health workforce task force, as well as the Washington State Opportunity Scholarship folks that are very interested in looking at taking a look at what our model is and perhaps leveraging a lot of the ideas and moving it forward to their various initiatives. No, good stuff.
Okay.
Thanks, Dan.
That's good.
Next.
Okay.
It'd be Diane.
Okay, this was, yeah. So we decided that we were going to send out the $300,000 that the board approved for our providers to implement telehealth. when this went out, we had 42 that were we paid $6,000 to, and then we also had, well, some of them requested less than 6,000, so whatever, it was up to 6,000 for the organizations that they could get. And then we also have had a few more since then. I think we've funded all 45 of our organizations, as well as some CA community action centers across the region. So we're pretty excited about being able to help with this, to implement this telehealth. And I know that all the providers are using the funds, and they're very grateful for them.
Mm-hmm. Okay, excellent.
Chelsea, do you want to take this one?
Do you want to open it up and then I can go through how we got to the numbers?
Yeah, so the origin of this story around GCACH numbers and stories is that Greater Columbia ACH, along with the other 8 ACHs in the state, get together every month, and we talk about commonalities, alignment, advocacy. And one of the things that Artemis Consulting asked us to do was to put together what they called the numbers and stories. And so they asked us to fill out a whole bunch of information regarding the number of providers that we are working with, how many organizations, how many individuals in different sectors. So Chelsea did an extensive research through all of our distribution lists and sector lists and came up with the following information.
Yeah, thanks, Carol. So one thing we had to do was, you know, kind of go through all the different people that we work with or influence, make an impact to. And so that included things like the different healthcare sectors and social services. So as you can see through the list there, you can see all the different types of organizations. So we work with 310 organizations to help us meet our mission. You know, we work with approximately, 1,000 individuals or 1,200 individuals. You know, we were providing support and funding to over 70 organizations. You know, it just really shows the wide array of the visibility and the reach that we have, which is really cool to see when you actually put it into numbers. So this is really neat. This is ever evolving and ever growing as our reach and our continuation to help our region grows. So this is exciting. It'll be interesting to see how these numbers grow over the years.
It's really good. Okay.
This is just a report out. As you know, we have semi-annual reports that are due in July and January of every year that cover the previous 6 months. So SAR 4 was due in January. Is this right? Yeah. And it covered actually the period from July 1st through December 31st of 2019. So the header that they gave was just a little bit inaccurate. We received all the points that we could for the pay for reporting measures, and this is based on 75% reporting and 25% on achievement of performance initiatives. So unlike the next SAR report, which will depend 50% on reporting and 50% on pay for performance, the achievement of this funding, it was really dependent on this last go round on our ability to report out. So that's why we're working so hard with our providers to achieve those pay for performance measures, why the navigators are working very hard to help achieve all those pay for performance metrics, is because that's the way that you and we will get paid in the future. And then the chart below just shows you where those points and how those points are scored. So it is primarily the implementation of milestones regarding training and VBP, having the quality improvement plan, addressing gaps, and always behavioral health integration always comes up. So we're all doing a really, really great job in terms of reaching out to our providers, and our providers are doing a great job responding to our requests for information. Thank you.
Carol, it's Eric.
Hi, Eric.
Just curious if over the last few weeks you guys have seen any kind of a dip in that response. Many of us obviously are distracted with other things, especially providers, and I'm wondering if you're seeing an increased lag in their response and their reporting.
Well, we have given them some latitude on that, Eric, and I'm sure that Sam can speak to that, but we're trying to give them some more added latitude for reporting because we know they're extremely busy right now. Sam, did you want to add anything?
Yes, we extended it 15 days, so it's the 29th, or actually it would be 14 business days. So it's the 29th that they'll be reporting out. Thus far, everybody is appreciative, and I haven't seen any issues with them reporting or heard anything at this point. In fact, a lot of them have already submitted all of their documentation. So it looks like it was a sufficient time just to extend it for them.
Excellent, thank you.
You're welcome. So this is the Washington Rural Health Collaborative update. We are still in the process of trying to schedule some meeting dates to do the full launch of the WHRA for our coalition with them to take over those 11 clinic settings. This particular thing is about the CSI portal. We have launched their community page. Their technical support, which is hired for HRSA, is in Georgia University. And Wade is the gentleman that was for technical support that was on this first orientation for the CSI portal, and then as well as the board. And in addition to the director, they were very impressed with the portal. It's a minimized portal compared to the robust system that we actually have for our partnering providers to be able to report. But they were totally impressed, and Elia kind of cracked me up a little bit because she was like, this is what you get when you get homegrown. Not a big outfit out in New York that's doing this, but they know what we need, and they actually cater to our needs of our organizations and our providers. So it was really good, and it was insightful that they were super excited about the reporting metrics and that we actually have something that can capture the information. From what I heard from their technical support is that that's been a huge issue, and they've not seen any type of reporting mechanism this way with their other grant programs.
Okay, that sounds great.
Can you all hear me?
Yep.
Yeah.
Okay, so this is an article that we wrote based on some recent data that we received from Robert Wood Johnson Foundation. It was some interesting findings in the data, which are now broken down by ethnic and racial subpopulations. So the general understanding, based on research, is that socioeconomic factors drive health outcomes. So in looking at the Hispanic population, which indicates having lower median household income, higher childhood poverty rates, higher teen birth rates, and limited access to some types of preventive care, the general assumption would be that they would have higher premature death rates and longer or lower life expectancy. And the reality is that just the opposite is true, and it's not just in the GCACH counties, but it's across the state and even across the nation. In fact, the CDC says that Hispanics tend to have lower premature death rates than the white population by, I think, almost 25%, which is pretty profound. And a lot of this is attributed to what's called the barrio effect. And it has to do with the cohesiveness amongst Latinx populations in terms of where they live in their communities and their neighborhood. This has a real strong protective effect. So there's this cultural influence that affects health outcomes, particularly around mental health. We found that very interesting. However, the data shows that with successive generations here in this country, that Hispanic populations are now merging towards the overall rate of the white population in terms of things like diabetes, liver disease, and higher premature death rates. There's a number of things that can be done that are outlined here. Some of them relate to policy proposals. Some of them relate to community activities. The community health centers, the FQs in this community do a great job in terms of trying to provide access without prioritizing having healthcare coverage. So this is just a bit of research that we've put together based on our observation of the Robert Wood Johnson Foundation County Health Rankings data.
Okay.
Hey Wes, this is Ruben. Just as you, this is like the third or fourth time I hear this report, and every time I'm like, you know, like my family is testament of this, you know, and I think a big reason why this life expectancy rate, I think it might be because there's a large immigrant population within the Hispanic, the Latino population in the United States, and I remember when we first came to the U.S., we were undocumented, and usually when you come here as an immigrant, documented or undocumented, there's a network of people that welcome you in, that kind of protect you, and they teach you the ropes. There's this connection between you and those people from your hometown in the old country, and there's that connection. There's that sense of family, of a community, because you know you're not from the host country. So as you and your children, then the second generation and third generation, and maybe even yourself after being in the U.S. for a while, you start losing that. But I kind of see it there. I kind of see it because we tend to be low income, so you have that paradox, you know, that the life expectancy, but yet you are low income and you don't have access to preventive health. But I do think it's that sense of community. I do think it's that those bonds that you have and that you form with other immigrants here in the U.S. And because, like I said, you know, I lived through that, and I do, you know, my family, we've been here more than 40 years, and even though the family is still very connected, all the brothers and sisters, we see each other very often. We're not as connected with the rest of the Hispanic community. You know, we do as much, but our children, some of our children don't even speak Spanish, you know, and they barely speak Spanish. So you kind of, I kind of see my family as you are, you know, going through this report. I kind of see my family through that. So hopefully we will maintain and or recover some of that community, that sense of community, that connectedness.
Ruben, that's very insightful and helpful. Thank you. You know, the county health rankings, it's no accident. They also include a statistic around what are called social associations. So when communities or individuals lack that social cohesiveness, that's a risk factor for early death. So it points to the importance of what you're talking about.
Yeah.
Okay. Very good. What do you got next? Becoming patient-centered. Martine, right?
Yes, Martine.
Hi guys. So this article I wrote about Merit Resources in Ellensburg. That's their site that's going through practice transformation, and they have been doing a pretty good job, an awesome job actually, with practice transformation. And those were just, you know, they gave me some statistics and of, you know, the number of patients that have been able to get a primary care provider as a result of them, you know, doing case management more intensively with their patients. You know, they're educating them. They're using the EDI system, or collective ambulatory for them. And they've actually have been getting notifications of when their patients have been going to the hospital. They identified, I believe they said it was 3 that had overdosed, and they got notifications, so they were able to do reach out to them. And they're also identifying patients, that are going to the ED and that don't really need to be there. And so for those patients, they're providing some education as to, when it's the appropriate time to go to the hospital, and if when it is and when it's not, and when it's not, what other resources they have available in their community. So they're doing an awesome job with practice transformation.
Okay. I got it. Thanks. All right. That's good.
My turn?
Yes.
Okay. So many of you have, if you've been paying attention to the news, you probably noticed that food insecurity is one of the consequences of the coronavirus. A lot of the people that have jobs in non-essential industries are not working right now, and they are quarantined. So and many of them don't qualify for unemployment. So you can imagine how many families out there are running out of food and cannot collect unemployment and cannot go to work. So Second Harvest, which is a big food bank, and they supply other food banks with tons of food. I'll read you some numbers here in a second, but the demand for food increased so much that they are pretty much scrambling. They are desperate. So they reached out to us, and we thought it would be a good investment of our funding to help them out so they can feed our population within the 9 counties. One of the conditions for our contribution is that those resources go to the 9 counties and that they go to the most needy in the different regions that we cover. So tomorrow we're going to have a press conference, a virtual press conference, in which we are going to present to them a figuratively check, because the money's going to hit their bank account tomorrow anyway. But we have invited the press, and hopefully we get some press attend. But however, we did Lauren did a press release last Friday, and in yesterday's paper, the Tri-City Herald, there was a mention of this contribution to Second Harvest. So here's again our multi-dimensional, work on to address health issues in our region. This time by addressing the social determinants of health again. So let me tell you, so it is $300,000 that we are contributing to Second Harvest. They supply food to many other banks within our region. Let me just tell you by county, last year, 2019, how many pounds of food they distributed through the different counties that we cover. In a certain county, last year they distributed 851,000 pounds. In Benton County, last year they distributed 2.3 million pounds. In Columbia County, it was 12,000 pounds. I'm rounding up, okay? In Franklin County, they distributed 2.8 pounds. Not 2.8, 2.8 million pounds. In Garfield, 1,200 pounds as well. In Kittitas County, 447,000 pounds. In Walla Walla, 696,000 pounds. In Whitman County, 592 pounds. In Yakima County, 3 million pounds. So I think this was the best and the most efficient way for us to make an impact on the most basic of needs, which is food, social determinants of health. And we made that decision a couple of years ago. I'd like to thank the board for approving this contribution, and they're going to have the money in their account just within 2 weeks after your positive vote to give them this contribution. So thank you very much. It's going to make a big difference. And that's a little bit, that's kind of half of what the emergency request they had. Bechtel, I think, or P&L, I forget which company from Hanford gave him $100,000 like a week before we made this contribution. So they are gaining some traction, and hopefully this helps the people who are struggling throughout our communities to free up some of their resources so they can pay for other basic needs like transportations, like utilities, medicine, and other things like that.
It's really good. Okay.
So can I ask a question, Mr. Well from CHPW?
Okay, go ahead.
I just have a quick question for Ruben. So Ruben mentioned 300,000 to the 9 counties within the region. So are these funds, are they earmarked for each county, or is it just 300,000 for Second Harvest to use whatever amount in each county? And also, are there any other restrictions to these funds?
We didn't specify how much needed to go to each county. We just asked them to distribute the money based on need, and I think if we look at numbers, I just read to you the number of pounds of food that went to different counties. I would imagine that it would be that proportionate. But our only ask was that it was distributed based on need.
Actually, Ruben, if Becky wanted to talk about the MOU, she could explain a little bit further, Joelle.
Thank you.
The MOU. Yep. So I wrote up a really simple MOU for Second Harvest, and it really just said that we wanted to make sure that they distributed the money only to the 45 food banks that are in our 9-county region, and they agreed to that.
Mm-hmm.
And actually, Holly submitted a list today with Holly Seiler from Second Harvest, a list today with all the food banks that are in our 9-county region. Does that help?
Yes, it does. Thank you.
Okay. All right.
So for this year,
That's Diane,
the
right?
Learning Collaborative. Yep, this is Diane. So the Learning Collaborative, we only changed the one that was for Allison Nassari, and we changed that to August. So they're going to start in June. Our presenter, Elizabeth, she actually, in case we were to go longer of this stay home thing, she has agreed to do it online if that is in need for that. So we're just kind of playing it by ear right now. And if that's the case, then we'll go that route. And then they're the same as what they've been for the last little while. So we have one once a month for till till September, and then October we're having our recognition dinner like we normally do, and then we'll just have the one in December.
Mm-hmm. Okay. All right. That looks good. Questions there? Okay. Go ahead. Thank you. So that's the GCACH reports. Thank you all very much for that. That's great. You all do a great job with it every time. So appreciate that. So the next segment of our agenda comes forward to the action items. And first one on here, of course, is Becky, is with the March 2020 financial reports. We had the Finance Committee, last week? And so we had a quorum there. So Becky, would you would you like to walk us through all this?
So Brian, excuse me, we just had a couple more things under the GCACH reports and updates. There was the COVID-19.
Oh, look at you go, you're right.
Okay,
Yeah.
and then the field group was going to give a brief update on the community resilience campaign.
That's
Sorry.
fine. I lost my spot in my agenda.
No problem.
All right. Well, take it away. Ms. Lauren.
Yes. So I believe we presented a version of this COVID-19 resource list last month to you guys. And since then, we've made a bit of adjustments. This one is actually from last week, but we are updating it daily, and it can be found on our website. Previously, Chelsea, if you could scroll down a little bit. Previously, this section had highlighted a couple different maps that we had found on the Seattle Times. And we found after tracking these for quite a while that they weren't necessarily up to date, and the information wasn't 100% accurate. And so we actually decided instead to turn to the Washington State Department of Health website, where they are tracking the cases by county. And so we're starting to record that within our 9-county region, and we are seeing those numbers climb. Actually, today we broke 1,000 confirmed COVID-19 cases, and I think we're now around 60 confirmed deaths in the GCACH region. And then below, we just include a list of resources, and this is continuously growing. If you, as the board of directors, see any resources that may be missing on this list, please let myself, Carol, or Chelsea know, and I can add that information on here.
Hi,
Carol,
this is Matt.
Is there anything you want to add?
Go ahead, Madeline.
Oh, I was just noticing that there's one death recorded in Kittitas. Is that from DOH?
Yes. So to touch on that, what I found, it's actually interesting. So some days I'll look at Kittitas and there will be, for instance, Kittitas, and there may be 15 confirmed cases and maybe 1 confirmed death. And then the next day, those cases or deaths actually decrease. So I'm not sure it's 100% accurate, and I apologize if it's not. I think actually the number in Kittitas for confirmed deaths is 0. And
this is
I found that in the report today.
This is Julie in Ellensburg. Can you hear me?
Yes.
Okay, so that's one of the idiosyncrasies of the data, in that that particular Kittitas resident had a home in Kittitas County, but had been living in a long-term care facility in King County for like 14 months. So we've had a couple cases where data like that, we've been attributed or not attributed, and we have a very large student population here with CWU. So we police that data pretty closely, but the actual number is 0 for deaths.
Very good.
So this is Les Stallnecker. There's a group, there's a team that actually works through the data. And like you're saying, that counties, when they find out that someone maybe was in a county or was assigned to a county but really didn't live there, they move them around. There's often a large number that are unassigned because they're trying to figure out where they're at. Sometimes people are even out of state. It's just really hard for them. So the numbers do go up and down a little bit, but they work really hard to make sure it's as accurate as possible when they put it on, and they change it like at 4:30 every day or something like that. So
this is Eric. Yeah, like Les is saying, they do change a little bit, but I'm curious, are you using the county health districts for these numbers? Because, for example, you know, Benton and Franklin County combined are almost 600. So these numbers are way off, and those are all validated numbers through the health district after it works through the testing site reported back to the state and down through the health district. So I think if you can consistently use the health district numbers, that might be your best source.
Thank you, Eric. Yeah, we've been trying to find the best source, and like I said, we started with the Seattle Times, and we found that wasn't 100% accurate, and so we moved to the Washington State Department of Health website where they break it out by county. But we will take a look at some other options as well to see where we can get the most accurate information.
Yeah, I can send you some links to Yakima, Benton, and Franklin, and I think that would give you a really good starting point for the bigger ones anyway.
That would be great. Thank you.
Okay.
Well, this is Kat. Can I just jump in for a second?
Yeah.
Thanks. Thank you so much, you guys, for all your work that you're doing in this space. I think that it's just an interesting connection point to Wes, to your earlier article that you presented on with respect to the Hispanic paradox within that. Just the notion of the Department of Health just recently, I believe it was over this weekend, finally came out with data. We had sort of had questions within Washington State, so I think those of us could come up with assumptions in regards to the disproportionate impact of COVID-19 on communities of color and the recognition of that being true, and looking at some of the GOH data that finally did come out over the weekend and seeing that as a reflection within the Latinx population, seeing a disproportionate impact of COVID-19. And I just wasn't sure if that conversation has come forward either at GCACH with you all staff-wise, or with others in the region. And I think, again, just what it is elevating is that there are existing disparities within our healthcare system, and COVID-19 is doing a good job at exposing those disparities. And so I just wanted to see if that data had come forward and if anybody had any local discussions about that. So I'll stop there.
Kat, this is Carol, and we haven't had that discussion yet, but I think it's a really important one to have, and not only just the discussion of the disproportionate numbers affecting Hispanics, but why, and I think it relates to the types of jobs and industries that the population is involved in. And in fact, Megan DeBolt talked about this morning the outbreak at Tyson, which is a food processing, beef processing plant in Burbank. And there's a lot of, it's a new hotspot, and there's a lot of Hispanic and immigrant population that works at that center. So I think it's really something that we need to track, and maybe even start tracking on this website.
Mm-hmm.
So this is Rhonda, and I would just add to that a couple of weeks ago, there's a guy from the governor's office, I'm spacing on his name right now, but that started a conference call, a group session to talk about some of the issues, particularly in the Yakima Valley, that are facing the Hispanic population, to gather information about really with the upcoming harvest and what potentially is happening. I had a call last week just from somebody who had been bike riding out in Moxie and driven by a hop farm, and had seen workers that were working, very close together, no masks, no protection of any kind. And I basically referred her to the health department, but there is quite a community awareness about, with the upcoming harvest, about what this potentially could be exposing a lot of our agricultural workers. And so I think, the governor's office does appear to be interested in what more we should be doing, we collectively, and they're gathering information and asking for input on that. So that's at least one piece that's happening.
Okay. there's a lot here. I mean, you can slice this up a million different ways. Not to say that, you know, there probably is some level of health disparity. There's work disparity. There's all the things, and they'll all fall into this stuff as we look into them. I haven't had those direct conversations, you know, from my perspective, or at the you know, really very much in the community level. I think everybody's just trying to get through it right now. But I think we are starting to see some. I think, Ken, I think it was like you said that the virus is making our disparities clear, and so there is some truth to that, and I think we're going to see it as we dig through this stuff.
The one thing I wanted to just put forward, and something that, you know, we are considering as well, you know, as there are needs. I know a number of organizations have financial needs, and just wondering if, as there might be other decision points to be made related to funds being distributed related to COVID, similar to the fund that was distributed to Second Harvest, if there was an opportunity to consider, and I think, you know, needs to be a lot of discussion on how that would be done in the most appropriate manner. But to Rhonda's point, a consideration of maybe what organizations have engagement with the communities that may be impacted with the upcoming harvest, and those that are most closely engaged with those individuals that might need support, that might need. I know we're all struggling in getting PPE. So just an idea that I'm not sure if that's appropriate to be discussed at GCACH, but wanted to throw that out there as funds are, you know, being considered to be distributed.
So Kat, this is Carol, and I'm glad that you brought this up, because I know that the ACH leaders were curious too, as during this time, because we know that clinical visits are down, and emergency department visits are way down, that there is, you know, what would appear to be some more ability for the MCOs to get into this space. And I know that you've asked all of the ACHs what they're doing with their funding, but I think we would really appreciate having that same feedback from all the MCOs.
Yes, Carol, thanks for that. And we received Liz's request as well, and we're working to figure out the best approach to align that. I think we're working with the Healthcare Authority to figure that out in the most effective way possible of how that approach to advancing dollars could be done in the best way possible. There's been a prioritization around behavioral health providers at this point in time, and I know that there are other providers out there, of course, federally qualified health centers, rural hospitals, rural providers, really facing a lot of challenging issues related to revenue and how the revenue is driven. So I think that I can bring that back to my MCO colleagues around how we can, like I said, I know that we are working to try to best develop that shared approach. Some of the, if you might have seen the Healthcare Authority memo, MCOs are engaging specifically with providers around some of the requests, and I think working to figure out sort of what's that best approach to how we can collectively share that information. And happy to share also how we've compiled all of the information that the ACHs have shared with us across the different regions. So happy to share the matrix that we put together for that in the meantime, as MCOs work together to try to pull that forward. There's some things that we are trying to work out with the Healthcare Authority and CMS in regards to actuarial soundness and rate development. But I think, CHPW is trying to do the most and best it can as quickly as possible in getting funds out the door.
Mm-hmm.
Thank you.
Okay. All right, what's next?
It's our field group presentation.
Right, community resilience campaign. Is that right?
Yes,
Yes,
Brian, if I may, Nicole, if I may just do a bit of an introduction, kind of to remind the board that this is a report on the community resilience campaign pilot we conducted in Yakima. It ended at the end of March, and Nicole and Kristen are going to give us a report of the results of this pilot. This is the media component of the campaign, and I can touch on the training part of the campaign here after Nicole has completed her report. Go ahead, Nicole.
Thank you, Ruben. Really excited to be here to talk about the campaign. We've really enjoyed being involved in it. Thank you for allowing us to come and kind of share how it went. I did put a link in the chat if anybody wants to follow along in the report. The report's rather large because we did add in the creative elements in case anyone didn't have an opportunity to look at those. They're on about page 10 of the report. We're going to be mostly focusing on page 19 of the report, which is the media reporting. But before we go there, I would like to talk a little bit about where we got started with this, how we got involved and how we started. Ruben and some of the task force members did come to field group and gave a number of us a kind of a condensed version of the training, and it really showed us and helped us understand why this is so important, especially now with everything that's going on with COVID-19, the increased rates of domestic violence, kids not having that reprieve of being able to get out of the home and away to school. And so now more than ever, we know how important this messaging is. I know it helped us learn a lot about ourselves and about the people we work with. As an employer, it helped me understand a little bit more about some behaviors I see in the office. So I do think this is critical information to get out there. We think the campaign did very well. We had a lot of feedback that people received it well, especially a lot of the translations and the output or the creative that we put in that was translated into the Spanish language for our Spanish language audience. When we began, our main goals were to increase community resilience and to mitigate the effects of ACEs in our region. We did ask the task force what success would look like, and they said that that would be a total elimination of child abuse and neglect in our communities. And while we would love to see that happen, we couldn't promise that with a single media campaign. But we did establish some long-term goals, and that was to target the social systems surrounding children and educate them about ACEs, about protective factors, and about resilience, with a long-term goal of building community resilience. This campaign had a number of challenges. We had a very broad audience, that in and of itself. When we started looking at what these social systems looked like, initially we were thinking of the formal social systems of teachers, daycare providers, juvenile justice representatives, clergy. But as we moved further into it, the board or the task force also mentioned that they wanted to target the informal social structures, which were parents and family members and neighbors and those in the community that are around parents that might be able to step in, because sometimes parents themselves are just too close to the situation to see, and in some cases they're the ones that are kind of perpetrating some of these acts. They're too close to maybe see what's really happening with their children. But because we had this formal structure and informal structure, we had to kind of try to figure out which direction we were going to go with the targeting and the messaging. And because the goal initially was a mass media campaign looking at some of our traditional media of television, radio, print, we decided to focus on the individuals within those social structures rather than targeting the formal social structures specifically. It's hard with a radio campaign to say, we know that teachers listen to this radio station, or we know that the law enforcement watches this television station. So instead we targeted individuals. We try to have one message, and so we had to find what our long-term goal was and to focus on the building community resilience, and the challenge with that was that even within the formal social structures, ACEs is still somewhat of that's a kind of a familiar term, but not everyone understands it. The protective factors and resilience are still fairly new concepts. And in the informal social structures, there's really no understanding of ACEs, protective factors, or resilience. And so to try to message around all of that was a lot to try to fit into a media campaign. So what we did was we tried to identify a location that we could kind of use as a repository of information to store all of this information. And we decided to kind of develop a microsite within the GCACH website. We'll refer to it as a landing page, but there were multiple pages. And so we used the media campaign to try to educate to a certain amount, but also to try to drive people to the website to learn more. And the reason for that was a couple of reasons. There's a lot of great resources out there, and we didn't want to recreate the wheel, but we really needed a place to try to direct people to those resources. The Harvard studies, the CDC studies, we really needed a place to be able to help people find those resources and to try to find local resources. And the other thing about the landing page was that it allowed us to have a little more control over the Spanish language message, because we are all aware of the fact that a lot of times the messages are not equally distributed amongst both languages. Sometimes the translations are not done quite as well, or we rely on Google Translate to just translate a page, and so a lot of the content and the context is lost. And so GCACH works with a different type of translation service, plus we manually help translate a lot of the campaign materials so that it would be better understood. And the third thing the landing page allowed us to do was it allowed us to help identify how successful the campaign was. It helped us develop some metrics. As you all know, traditional media is really hard to track. How successful is this campaign? How many people are actually seeing these ads? We can tell you how many times the ad was distributed, how many impressions it got, but we can't tell you how successful it was. So we rely on the website to kind of help show how many people actually saw the ad and followed through to that ultimate goal of learning more about the campaign. So how did the campaign perform? The website did see over 4,800 unique visitors, and this was at the beginning of the month. About 3,500 of those were in English, and about 1,300 were in Spanish. Google ads, we were also able to track, so we wanted to rely a lot on digital because of that. The Google ads initially were developed so that they were pulling information from the website to help tie the ads and the content together. And what we found was in our region, and that's why this was a pilot to see what works and doesn't work, in our region, people just aren't searching out the terms that we have on the landing page, ACEs, community resilience, protective factors, and a lot of those terms because they're just unfamiliar with them. And so we shifted about halfway through and started using other terms that people might be searching for, such as behavioral problems with children, helping a child through divorce, helping a child through loss, helping a child who's been abused, those types of things. So we shifted, and when we did that, we did see the impressions go up a lot more. We did receive over 214 impressions on the Google ads with over 6,000 clicks. The click-through rate of 0.44% over the total course of the campaign. And for education, our average is about 0.53%, so we were a little low, but we know that we were not doing well in the beginning, and we did see that going up towards the end. Search was not, we didn't initially do search because we knew that that would be hard for people to tie those terms into the campaign. About halfway through, about the same time, we decided to try some search using these terms that we had developed for the display ads. And that actually was very successful. We saw 89 clicks. The ad was only shown 927 times, which is a click-through rate of 9.6%. That's much higher than the 3.78%, which is average for education in search. And we kind of bounce between whether this is education or healthcare. I know it kind of falls in the middle, but we felt education was a better category. So Google and search, we do think, have a lot of good opportunities for us moving forward. YouTube ads got off to a slow start as well. Same, they were in that search criteria. But we did see a lot more success as we progressed. The ad was clicked 91 times, and over 30% of them watched past the halfway mark. I think we're all familiar with skip this ad that comes up when you're watching. Most of them watched beyond the 50% mark of that, which is really good. However, the outside of the ads on Google, the videos on YouTube rather, the videos on YouTube did very, very well. The English video was viewed nearly 6,000 times in English and 3,000 times in Spanish. And so it was a very, very strong tool in the campaign. The organic social media also did very well. We did some PR with Minerva and Ruben, and Lauren had posted that, and the organic engagements with that were 1,611 individuals with 16% engagement. So that did well as well. Traditional media is a little harder to measure, as I mentioned, but so we were looking through more of how many people then pushed through the landing page. But what I can say is we've received over 5 million impressions with billboards. We saw over 1.2 million radio ads, impressions with radio ads, and over 350,000 impressions in print, and that is all within the Spanish. The print was all in Spanish language. TV ads ran over 1,300 times throughout the duration of the campaign, and most of our local media partners, especially our electronic media partners, did offer us bonus spots. So for every spot we bought, they did match with at least one matching spot. In addition, they helped us by posting information on their social media accounts and offering us opportunities to go and present and do an interview on the stations. Ruben and the task force did present at KIT Radio here in Yakima, as well as Univision and Bustos Radio. So in all, we spent $66,000 in media at an average of about $22,000 per month on the campaign. 47% of that was in Spanish language ads, and 27,500 went to English media for about 53%. We did choose some English language radio stations that are popular with our bilingual audience. And so we spent over just about $23,000 developing the campaign materials, but the campaign materials, and that included having them in dual language, the video, the graphics, the landing page, the brochures, placing the media reporting, that was all of that in the $23,000. And we developed the campaign specifically in the style of animation so that when we moved it into the 9-county launch, we could continue to use those same materials. I know most of you saw the campaign materials, and we also intentionally wanted to just like indicate people. So we didn't want to have to keep changing up based on within each of the Spanish language, or there is talk that we may have to do additional languages in some of our other areas. So we wanted to make sure that we could use these materials to just represent people in general. That's why red people and blue people and green people. Partially just to illustrate people, because this does affect everyone, and partially to make best use of the cost and be able to repurpose these materials when we went into the 9-county launch. In general, in addition to the pieces that we were paid for, Field Group did put in over 477 hours into the campaign, and so we donated about $40,000 worth of work to get all the pieces together and to manage the campaign, just because we really feel like it's an important campaign, an important message to be out there. Moving forward, we have talked about some of the changes that we're going to be making moving forward, or that we would recommend. The landing page worked very well, but we do think that it needs to be much more robust. And in particular, we really want to see the resources lined out a little better so that people can understand where the resources are located and what each one of those resources, identify the different groups that those resources may be related to, such as for parents or for teachers or for daycare providers. Kind of trying to identify that a little better so that they don't have to look through all of the materials to try to figure out which one relates to the position that they are in. We also want to shift the campaign a little bit as we're moving into these more rural areas and rely less on traditional media such as television. We do probably want to maintain some radio because radio does cross over into a lot of these areas, and so we think that's going to be a more cost-effective tool. The video was very successful, so we would like to look at using video through YouTube and digital ads. And so we're going to be relying on the next stage of the campaign on mostly digital, some traditional medias, But we're also going to do some outreach to influencers within each of the 9 counties and try to do a more grassroots effort and dedicate more of the budget towards those kind of tools of reaching out directly into those formal social structures rather than, or formal social systems rather than the informal ones as heavily. So we're just going to shift focus a little bit on that. So that is where we are at with the campaign. Again, we felt very strongly that it went very well, and we're very proud of the results and of the campaign itself. I'm happy to answer any questions you might have.
I think it's great. I shared a couple of months ago, I think that I had seen it running on the television a couple of times. I was very impressed.
Thank you.
Clearly got out there. Other thoughts?
Any more comments for Nicole?
Just thank you for also the donation of in-kind time. That's much appreciated by the organization.
Thank you.
Yes, thank you. So Brian, I would just like to add, at the same time we were running the campaign, we also conducted some in-person trainings for people in the professions that Nicole mentioned. We targeted daycare providers and people that work in agencies, organizations that work with children and families. We had 3 trainings scheduled, and the trainings were very, very specific on the neuroscience and the trauma-informed approach. And so we had 3 trainings scheduled. We only got to do 2. The 2 in English. The 1 in Spanish that was scheduled for March 28th was canceled because of the pandemic. So we ended up on those 2 trainings that we held. We had 66 people attend both of them. The second one on March 7th. By then, the pandemic was already big news. They were encouraging people to stay home, but we still had about 26 people attend that one. So still pretty decent numbers considering that the pandemic had broken out already. So so we are looking at the next steps. We are preparing to get ready for the launch. You're looking at analyzing everything, looking at what adjustments to make on the messaging and the different media platforms like Nicole mentioned. And also the task force recommended that that we suspend any in-person trainings and to look into putting together webinars. The training was 3 hours. So they're recommending that we look into maybe doing 3 one-hour webinars to make those available online. And certainly we are going to get to work to put together the next steps and bring them to you at a later time.
Okay, that sounds fine. It's obviously a great deal of work that you all have done on that. Thank you very, very much. Good presentation, too.
Thank you.
Thank you.
Okay.
Thank you, Nicole.
Thank you. We'll get out of your hair.
All right. Thanks.
Have to get out of our hair. Not everybody in there has hair, as I recall.
I have a lot of hair right now. I haven't had a haircut in 2 months.
That's pretty funny. Okay, so let's move into the action items. Thank you again for the reports, staff reports and such. All right, first one we've got on here is the March 2020 financial reports. Becky, do you want to start us off? We met last week?
Yes, we did.
Okay. Why don't you?
Yeah. Let's look at the budget versus actual spreadsheet, please. Thank you. Okay, so this is our budget versus actual spreadsheet that we normally walk through with you guys. You can see our revenues accounts that we have for the year. One of them is our Rural Health Collaborative grant that y'all know about, and we have actually received a payment that you'll see for April. and probably have 2 payments on by the time we run the April numbers. So that's exciting. Our design funds, you can see we had budgeted $2.2 million and we are $353,000 into it. So we're doing pretty good on our budget for this year, I think. And then our Numerica investments, we've earned $27,565 so far on interest on that $6.4 million that we have in that account. Let's go down to the expenditures, please. So this goes into detail on the line items from our budget. Again, I kind of always scroll down the percentages and just check and make sure that we're doing okay. And we're into Q2 of 2020, so I think that our numbers all look really good. The loan contracts you can see is up to 72%, but that is finishing up payments from the 2019 contracts, which are almost done. We sent out a bunch of those payments this month, and we're going to finish that up. And then we have our Q1 loan payments coming out of district this year, so we won't be seeing that line item on this report anymore.
Okay.
Can you scroll down to the pie chart, Chelsea? So the pie chart kind of gives you a visual of where we spend our money and how, what the biggest chunk is, of course, in operations is payroll. So can you go to the district tab? Thank you. So this is showing you how much money we have spent out of our budget for our district money. And we're still cranking out payments on our PCMH contracts. And then now we're spending some money on COVID, which we talked about. And the Healthcare Authority is really asking us to keep tight tabs on where we're spending that money for the COVID response. So we are doing that. And when this is all over, I'm sure we'll have a nice report for you to tell you what we did and how we spent money and where we spent money. That's pretty much it. We're not really doing too much right now because we're all working from home. So is there any questions? I know I went through that kind of fast.
Well, I can speak to the rest of that meeting. I mean, we did talk a little bit about, and there were, I guess it was Rhonda was on the call. I was on the call. I think Kat might have been on that call too. I can't recall.
Yep.
We talked a little bit about, we went down through the, like we always do, we went down through the line item expenditures, the monthly line items. Everything is fine there. We didn't see anything that was, out of sorts or unusual. There's an odd carryover from year over year on the balance sheet, but once it was explained, it made much more sense. It's just an accounting thing coming back and forth from the audit year over year.
Mm-hmm.
And so the meeting was very good. It was well presented, and all the materials in there looked fine. It is clear though that people are at home and not burning a lot of miles or gasoline or any of that stuff. So that was clearly seen in the presentation. So we also talked about the decision to move the food bank or to do the food bank money. I know we talked about that as well in the finance committee. So everything was well presented, and well made. And so I would make a recommendation that we would advance the finance committee documents as they're presented to the board for approval, and I would look for a motion for that.
So moved.
Second.
Thank you very much. Anybody have any questions, concerns, or comments related to the financial statements for March?
I have a question. This is Lauren. Who motioned and who seconded?
Eric motioned.
Rhonda second.
Yeah,
Thank you, Eric and Rhonda.
Okay. All right. Any, what was I going to ask you? Oh, all those in favor, please say aye.
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 Any opposed? Okay, thank you. Motion carries. Thank you, Rhonda and Eric. And
Thank you, Brian.
Thank you for running that. Next one we got SBAR for the Win 211, updates to the Community Resource Directory. Lauren and Wes, right?
Yes, I will start, and Wes, feel free to jump in if I miss anything. So many of you know, we've kind of been talking about this on and off for a while now that we have been researching where we can best support an updated community resource directory. So just to give you some background, a community resource directory is a convenient and regularly updated directory of community-based organizations and programs providing services that can help address consumer social needs. GCACH and their stakeholders and partners require a comprehensive, updated, and online community resource directory to serve the needs of their communities in the GCACH region. A valuable community resource directory will have a front-end interface and a back-end database that is useful to the end consumer. So a little bit of background. Win 211 is a statewide service organization that helps connect people to social services. Win 211 is well established with name brand recognition across the state and has a sustainable funding model driven primarily by legislative support. Along with this, the increasing move to value-based payment models over the last years by health insurance and government payers has driven healthcare organizations to seek ways to address their patients' social and economic needs. To know where to refer patients for non-medical needs, healthcare organizations have traditionally relied on informal approaches such as hard copy or electronic lists, such as an Excel of local service providers or the experiential knowledge of social or community health workers. With that, GCACH has conducted an analysis process of consumer resource directories that included reviewing several different CRD technology platforms, investigating in the development of a CRD app, back-end database validation, front-end interface evaluation, and we also gathered some informal feedback from those that work directly with consumers that use the either Win 211 database or Aunt Bertha or other consumer resource directories. Once we gathered that information, we came up with an exhaustive list of what we think the ideal consumer resource directory would look like, both on the front end and the back end. So those features include, specifically for Win 211, updating their homepage, adding large icons to their homepage, adding subcategories, intuitive location services, language conversion, intuitive resource category searches, advanced search capabilities, account creation, and having the ability to do that. Through account creation, you will be able to have favorites, geolocation mapping of services, sharing of resources, either through email, social media, and also have a list of suggested readings that pertain to what that consumer may be searching for. And so with that list, GCACH is recommending collaborating with Win 211 to make updates to both their front end and back end website to implement these changes listed above by funding Win 211 $40,000 to upgrade their website. Wes, do you have anything you want to add to that?
You know, just to give a big high-level perspective, it's been obvious since the beginning of this project that healthcare organizations are taking a more holistic view around the well-being of patients and consumers, and that social or non-medical factors play a major role in both individual health and population health. So we've seen, and we actually are facilitating health leaders in trying to find ways to integrate not just behavioral health, but also social service agencies into their work. As Lauren talked about, we've looked at a lot of models, and we've paid particular attention about a sustainable financing arrangement for any model that we decide to choose. And based on what we've seen with 211 and their consumer resource directory, not only that, their ability to partner with us, they've been great partners all along. They've been open to our feedback. In fact, their developers have taken some of the analysis, the great analysis that Lauren did. She's done so much work behind this, and they've really incorporated it into their work. So that for us just kind of solidified the quality of the relationship between our two organizations. So we really want to support their current work that looks at those list of attributes that we've identified as being important. To be honest, they haven't adopted all of them, but the ones that we think are make or break, they're embracing and trying to incorporate into their developmental process with their developer. So that's kind of the big overall reason why we're going down this pathway.
Okay. Can I ask you a quickie question? Is there any way to, in your guys' mind, and this truly is just for my edification, is there any way to determine if this $40,000 investment, right, into Win 211, is there any way to find out or to know if it will have helped make the Win 211 program not just more accessible, but more used, shall I say, right? It's great that it's more accessible, but if nobody uses it, then it's kind of burn the money. So is there a way to track improvement in use? Would that be a fair statement?
Well, you know, perhaps an indirect process measure might be, we're trying to, in fact, we are, or we have negotiated second-year contracts or contracts with our LINs that incorporate, you know, some sort of arrangement where they work with the 211 rep on at least an annual basis to come in and to talk about what's in the Win 211 database for that particular local health improvement network to make sure that it's updated and timely and accurate. Right. That doesn't necessarily mean, Brian, that they're going to use the application, but at least it's a recognition of what's currently in the system, and hopefully that leads to additional use of Win 211 in the consumer resource directory.
Yeah, no, I get it. I'm just, like I said, I'm just wondering if there's I mean, you can make a really pretty website that nobody uses. I would
Brian,
imagine.
this is Lauren.
Yeah, Lauren, I think I know what you're going to tell me, but go ahead.
Yeah, so I was just thinking when you were saying that, you know, every website has insights and they can track those insights, and maybe that's something that we can ask of Win 211 is them to give us some sort of report, which should be fairly easy to find. I know ours are easy to find, but some sort of a report that says what the average visitor count looks like on a week-to-week basis, and then what that user count might look like after these changes have been implemented. And you can also see, you know, how much time people spend on certain pages. I'm sure they can also track what people are searching for. So I'm sure they have those insights, and we could maybe see if we could work with them to gather that information.
Good. That actually is what I thought you were going to tell me. So I'm super impressed with myself because I'm like not.
Brian,
I
read your mind.
Yeah, I guess, right, Rhonda? right?
Yeah, so yeah, that was good. So, but I have a comment just based on Wes's comment that from the Lynn standpoint, I would hope that you would not put that responsibility on the Lynn's, but rather that it would be the responsibility of 211 to reach out to the organizations. I mean, we you know, they have an accreditation process they go through, and so I know they reach out to us every year to update our information, and I think that's part of their responsibility. I don't see that as a Lynn responsibility to reach to 211 as much as it is their responsibility to reach out to us. And the way people use the information is to find the information useful. So I would just ask that you consider that when you're looking at the Lynn contracts, that that's really not our responsibility to 211, it's their responsibility to us.
And Rhonda, this is Carol. I think the way that the contract is written, it really does lend itself to be more a partnership, and that 211 could be a great website, but if they don't have the information that they need to put on it, then they're in a conundrum. So it's more of the willingness of the Lynn's to meet with the 211. At least I think we put it on a biannual basis, I think, just to review and make sure that all of the organizations that need to be listed are listed. And then to get to Brian's concern, I think that Lauren and Wes did a really good job of going to the most popular websites for consumer information. And that's why we made the recommendations that we did to 211, is we felt like they actually have really good content. Compared to even Google Docs, the content is more relative to what our consumers are looking for. So it was more a matter of just making sure that they listed the best routes that were closest to the food banks, you know, really simple tweaks that they could do and that they are doing, so that it becomes a much more valuable resource when people start using it. I know when we talked to Tim Sullivan, though, I think he was very interested in doing some more marketing so that people would be more aware of some of the improvements that have been made, the new and improved site for Win211. But we really were impressed with its content, because most of these other websites, although they might look fancier or schmancier, they're actually stealing the content from 211. So we felt that we wanted to support our local agency, and we really appreciate the exploration that we've done together, and that they have been really willing to look at all of the improvements that we're suggesting.
I'm not at all questioning that, Carol. I mean, I wouldn't want to be working with a different resource, because we do spend a ton of time, you know, updating our information in 211. That's not my question at all. That's not my point at all. I just want to make sure that the relationship is them reaching out to the Lynn's versus it becoming our responsibility to reach to them. That was my only point.
Yeah.
It's a good observation, and you know, I think that the GCACH would actually, once the development process concludes, at least for this phase, I think we would also like to be part of that that marketing opportunity for them to you know, show the new improved interface. We know that the backend database has gotten a lot better. To be fair and honest, very early on in this process, we received a lot of mixed reactions about the usefulness of the tool, and in particular the app that came with the tool. That said, there have been a lot of changes, and I'm excited about what this potentially is going to lead to, and I think that users will ultimately find this more useful than they might have in the past.
Okay. Do you think there's I'm with Rhonda too. I think this is the right. I don't have any issues with this being the right thing to do. I don't have any issues with it being with the right group either. But I do like the idea of maybe having accountability is always good. If somebody knows you're looking, then they make sure it gets looked at. You think we can have some follow-up at, I don't know, whatever period of time, maybe it's 6 months out, to see if it's had an impact? Maybe it's a year.
Hello, it's Ronnie. I just have a question, because a lot of things online are going to apps and app capable. And I'm wondering, you're saying for their website, I'm wondering if there is an app that's going to be downloadable. Like a lot of websites are doing that. They're giving their apps as a complementary to their website.
Mhm.
Ronnie, this is Lauren. I can answer that, and Wes, feel free to add. But from what I know from talking with Win211 is that they will be making these updates for a mobile website. They aren't necessarily going down the road of an app because they found that more people are willing or wanting to just look on a mobile site instead of downloading an app and going through that process. Wes, is that what you remember as well?
Yeah, I mean, there was some research that was done by the University of Washington as part of a capstone project that, and in their research, and I understand their reasoning, they didn't necessarily support an app, and there's technical reasons for that. If you build up an app, you have to do it, develop it across several different operating systems, Android, iOS, maybe Microsoft and others. It needs to be scalable according to the device that you're using. There's some technical considerations, and as part of that project, I think that they thought that the target population, not the entire population, but the target population that we're concerned about, would be more interested in a scalable mobile interface that comes off of Win211 rather than downloading an app onto a smartphone.
Yeah, that makes sense.
Thank you. Appreciate the answer.
Okay. All right, Lauren, again, I think it's super work. I'm going to go back to that question. You think those guys could give you that information, a follow-up, maybe say, hey, this worked or it didn't work, and maybe we can loop back around and see if we can tie that loop later?
Yes, definitely. I think that's something we could maybe add to our contract as well that Becky will be presenting after this.
And I do appreciate that if you haven't had that conversation with the company, then they're not going to know to, nor can I ask you to commit to that on their behalf. I mean, I'm just looking to kind of close that package up,
No, I think that's a great idea. Numbers show a lot, definitely.
Yeah, and I'm sure you're right. I'm sure they can. I'm sure they can get that data. I mean, my goodness, if we can get that data, they can get that data. Because again, we're not that tech savvy at my house.
So Brian, I would be prepared to make the motion to move forward with the 211 contract. This is Rhonda.
Very good.
This is
Thank you.
Sandra. I would second that.
Okay. Motion by Rhonda, second by Sandra. Any additional conversation here?
And this is Madeline, and I'm going to be abstaining from the discussion and vote.
Good. Okay, so noted. All right. Hearing no other comments, I would ask all in favor of moving forward with this contract, please signify by saying aye.
Aye.
Anybody opposed? Hearing none, motion carries. Thank you very much. Congratulations. That's good. Very good. Thanks, Rhonda. What's the next one we got on the agenda here? So the next one is, wow, we jumped through both. We did the update and we did the Wayne contract all in, right? Becky, did we just not approve the?
Well, we were going to show you the actual contract and have you guys look at it, and sounds like we have a couple more things to add based on that conversation that we just had.
Mm-hmm. All right.
But and I also really quick just want to follow up with Rhonda about the Lynn contract. What we wrote in there, Rhonda, in the scope, it says facilitate a collaboration with Win211 to update their local community resource directory on an annual basis. So it's a little bit flexible in that, and I know that, like you said, you guys already do that. So I don't think that it's anything new or different.
Oh, that language sounds fine. That language sounds fine. And when I said we, I was actually talking about as an organization, not as our Lynn. But facilitating facilitating, I mean, what you just said sounds perfectly fine to me. I mean, I need to take it back to our Lynn, but that language sounds fine to me, personally.
Okay. Okay, great. Yeah, it's in the
And
contract,
Rhonda,
so you should have that.
and Rhonda, we had different language, and I think it was you who provided feedback on changing it to make it more flexible, and that's is reflected on the contracts.
Oh, well, that's why it sounded good.
Yeah, right.
Yeah, it was Rhonda and Kirk Williamson, if I remember right. He was the one, because we had in there some more restrictive things about like making it accurate. I think that was one of the words that we had in there, and Kirk asked us to take that out. So we have changed it based on your guys' feedback.
Okay.
And again, I'm still okay with the contract, even in the manner that it's written. If you guys can get that additional piece in there as an addendum or something, that'd be great. And I'm comfortable from there. If everybody else is. So I think we can probably move on. We have a unanimous move forward with the Win 211. Lauren, if you can get that additional point in there, that's just a bonus. So let's see if we can do that, and I think we're off to the races already. Okay. So next item on here is the contract extension for this SBAR, right? For the contract extension for consistent care services.
Yep. So this is Diane.
Yep.
And so Consistent Care and Blue Mountain Heart to Heart have been the network manager for the ORN in Benton, Franklin, and Walla Walla counties. And their contract expired on the 31st of March. And so we feel that they have done an excellent job. Not only in their numbers does it show, but also in their customers and their wraparound services that they provide for their people. And so this just shows a little bit. They were required to have a minimum of 100 unique individuals inducted into medicated assisted treatment within the Benton, Franklin, and Walla Walla counties. And they actually went over they doubled it. Consistent Care had 86, and then Blue Mountain Heart to Heart had 147. And then it kind of has a little bit of breakout there. And if you go down further, Consistent Care has another program that they have in. Those are the patients that are enrolled for 120 days that have extensive case management, and so they have 28 that are enrolled in that were started out in inductions through them. And then below are the wraparound services that they provide. Consistent Care provides quite a pretty heavy duty wraparound from
Can you keep scrolling, please?
Sure. I'm not scrolling. Sorry. Okay, here we go. So those are the enrollments that Consistent Care has. And then if you go down further, Chelsea, I'm sorry, you'll see that Consistent Care has quite a bit of wraparound services, from housing to food/gift cards, to overdose kits, bus pass, medical care coordination, a monthly bus pass. They also do the assessments and cell phones and other things. And so you'll also see that Blue Mountain Heart to Heart does provide wraparound services as well. They're just not as in-depth as Consistent Care is, but I feel that they have done an exceptional job, and we have the funding to fund them for one more year. And so that's what I'm bringing to the board. And this next year, one of the things that will be really focused on is coordinating with our sites that are going through practice transformation, to coordinate with them to make sure that that the patients are have a primary care provider, and that they're working with our GCACH partners, and kind of training them on how to make sure that their patients if they have patients that need medicated assistance, and helping them route through the whole system. So that's kind of what next year is going to be about. And we're really focusing on kind of transitioning some of that into some of the primary care organizations, as well as them working with the behavioral health and mental health professionals as well. So our recommendation is that we approve a contract extension for 1 year, which would be April 2020 to March 2021, and it would be for $300,000, and that would come out of the district incentive funding, which is where the funding has come out from before. And it's a dual partnership with Consistent Care Services and Blue Mountain Heart to Heart for the Benton, Franklin, and Walla Walla County.
Okay.
And just as a reminder, this is Wes. This work directly supports a very important pay-for-performance metric, which is substance use treatment penetration rate. So the success that's brought out of that does go to feed into that measure.
Mm-hmm. Is it being successful?
Well, unfortunately, because those measures are lagged, it's going to be a little while before we find out for sure. But simply looking at these numbers, it's telling us that it is being moved.
Okay.
So I can tell you on the receiving end of this, there are quite a few people that I have that utilize these services daily, monthly, and annually.
Okay. Well, I think there's certainly value in continuing with what you've already started, right? Otherwise, you've got to start over again, and I don't think that makes a whole lot of sense. Do we know what the...
No,
I'm sorry?
Sorry about that. No, I think that continuing the work, in fact, they've kind of been our exemplar ORN, basically. They've helped our other 3 ORNs get, their footing, and it helped them develop their agreements with the providers that are part of the ORN. And so I really feel that 1 more year would be definitely a good thing, and we have the funding for it. So I think that and it'll be a little bit different this year. Last year was just getting the 100 inductions, but I think this year we're going to really focus on them trying to bring that in through the practice transformation. So I know that Martine and Sam have meeting with the ORN workers other than Becky, but there's a couple of the couple different nurses that they have that already have the meetings set up with Martine and Sam, and so I'm hoping that they can work with the navigators and really focus on working with our providers.
Okay.
For the next year.
That's actually very useful information, so that helps me a great deal. All right. So can we have a motion from the board so that we can have any additional discussion?
This is Ronnie Batchelor. I motion that we accept the recommendation as is.
This is Kendra. I'll second.
Okay, motion by Ronnie, second by Kendra. Any additional conversation with regard to this matter? Again, I think you've done a nice job presenting it.
Thank you.
I don't have any concerns about it. I always wonder, I always want to know what we're going to spend the money on, right? But again, I appreciate that you're kind of in a startup. It's good that this is the exemplar. They seem to have achieved the goals from the prior year, right? And so I think that's very valuable.
This is Kat from CHPW, and the only comment that I'd like to make, and so it's sort of an action item for me, is I think it'd be great as we are looking at re-upping funding this year, which I support, especially as an exemplar, is just the consideration of sustainability. And so how we can have that discussion, I think it probably needs to be a broader discussion with respect to the joint MCO group, as well as considerations with respect to the healthcare authority, as they've funded some of the ORN networks in other regions, but because they are not across the Greater Columbia ACH region, how might we consider what that looks like when there's great work happening in that space? So, thank you.
That, Kat, thank you for bringing that up. I think that is really great because there was only one state opioid resource network in our region, and that was in Yakima. And they're doing really great work there. So I really feel that our ORNs are doing just the same kind of work that ORN is doing. And so it would be great to be able to have that conversation. So we'll definitely have that and put that as a thing that we'll work with, trying to get the next year maybe funded through the state.
Yeah, Kat, you really are in my head. What's wrong with that? Anyhow, I was thinking the same thing, is how are we going to, it's a successful program, and I know by boots on the ground. The question is that once this money is gone, how are we going to get this sustainable, and what's available beyond next year or the year after?
So this is Carol. It might be helpful, either Martine or Sam, to talk a little bit about the 6 building blocks program and how that folds into the discussion through practice transformation.
Give me like 5 minutes and then I'll take it.
Hey, Carol, this is Martin. So the 6 building blocks, we are still scheduled to have a training with some people with other ACHs, the 6 building blocks, which basically that will allow us to work with a clinical pharmacist in one of our sites, or not the pharmacist, but more of the providers, the prescribers, and kind of teach them safer guidelines when they're prescribing opiates, and what are the different avenues of, are there other resources, other than opiates. So that training, I believe we have a call coming up in a few weeks, which is just a basic introduction, which is an hour and a half. And then in May or August, I can quite remember, we have the full 1.5 training, and more than likely it will be virtual, but that's coming up for us as the navigators. And then Sam and Diane, I believe, are also going to be taking the training with us.
Okay.
Thanks, Martine. So I think it was the idea behind the ORNs is really a bridge to help give the providers time to build capacity within organizations, if they so chose to do MAT and provide those kinds of services. So I think it folds into that whole conversation about sustainability, but this was kind of meant to be some kind of a bridge program in order to get us ready for provider MAT services.
So this is Rhonda. I would just add that I think your strategy of for the next year of helping them kind of build that relationship with the primary care providers is really important. As a reminder, the Yakima ORN is a 5-year project. It does sunset after 5 years. So then the sustainability plan is just that, to build it into the relationship so that what we call the navigators are built in and connected to primary care. And that is the sustainability model. So I think your strategy of building that into the next year is the way to do that.
Yeah, that has been our plan from the beginning. And so that's why we had enough funding for another year to kind of transition it, because we knew the first year that most of the providers are really just focusing on getting their infrastructure, getting used to the reporting, and getting used to all of that. So that this gave the ORNs enough time to really kind of build it up. And then now I'm hoping that, that's why we're linking in with the providers this coming year, that we're hoping that it will give them time to transition some of those jobs out there. But, consistent care and Blue Mountain Heart to Heart are still going to be around. to do case management and things like that. So if a provider continues to want to do that with them, then that, that's something that they have developed that relationship with, that we've facilitated this coming year, that they would be able to do that if they wish to do it, go that route.
Okay. Excellent conversation. I think we are probably in a situation where we're ready to make a decision here. We have a motion and a second on the table. Are there any other conversation points to have here? Okay. Then I would call the question. So all those in favor of extending the contract for another year, please signify by saying aye.
Aye.
Any opposed? Okay, thank you very much. The motion carries unanimously. That's very, very good. Appreciate all of the hard work done there. And then I guess our last item for discussion and action today is the Community Resilience Campaign Task Force Charter with Ruben.
Yes. So the task force, the Community Resilience Campaign Task Force met last Friday, and we reviewed the charter, pretty much because the pilot was over and we're about to prepare for the 9-county launch. So we reviewed the charter for those purposes to make sure that we are still, close to what we decided on the charter and what the board approved on the charter. So it looks like we are pretty close. Also, we wanted to talk about the charter as well, considering the current situation with the pandemic. And so we reviewed the charter, and the task force only recommends the two yellow, the highlighted areas on the first page on the purpose section. So we are bringing it to you to approve these two changes, pretty much removing the year 2019 there, and to add at the end of that paragraph, to add or other languages as necessary.
Okay.
I can answer any questions. I can answer any questions, or we can consider this for approval.
Yeah.
Sorry,
so my only question is, so this is, I'm assuming that this charter was approved last year, correct? Is this a new charter?
Yes. May of 2019. Yes.
Okay. So it's approved last year. We've only got these two changes to make?
Yes, those revisions.
Okay. Well, I would entertain a motion to approve this thing as with these minor modifications.
And this is Madeline. I motion to approve.
Good. Thank you, Madeline. And we
This
are.
is
Dan Ferguson. I'll second it.
Go ahead, Dan.
So
Yeah.
Dan with the second? Okay. I can't imagine there's a whole lot to talk about. Do you all anybody have any questions or additional comments for Ruben on this? Very good. All right, so all those in favor of approving the minor modifications to the task force charter, please signify by saying aye.
Aye.
Excellent. Any opposed? Any abstentions? So very good. Ruben, this one is approved as written as well, unanimously, so congratulations. All that is good.
Hey, thank you. I think we set a record.
I'm telling you, it's because we're doing these things remotely, I think. Is there any other matters to come before the committee, to come before our board today? Carol, do you have anything else that you need to advance?
I do not.
Wow, that's great. You want to talk about text you sent me about a second harvest presentation or something tomorrow?
Yeah, well, we'll send out, I don't know if Lauren has sent this to the board or not, but we're trying something new tomorrow in this day and age of telehealth and virtual meetings. We're going to try a virtual press conference. It's kind of fun it's kind of like having a Brady Bunch meeting when you see all of those squares across your screen and everybody is joining in and chatting. So we're going to try to do a 9-county press conference. Lauren has been working with media connections. We've been reaching out to some of the board members to get personal connections with the media, since that seems to work a little bit better. Jason Clark, who's the CEO of Second Harvest, will be joining us. I think Brian's going to be our spokesperson for GCACH, and we have some pretty good quotes lined up for you, Brian. But we're looking forward to it. All the staff members are going to create signs about what Second Harvest means to them, whether it's they're caring or they're an awesome organization, so that we can hold those up and take a little photo or a screenshot of who is participating in the press conference. And but you're all invited to attend. We'll send out the press release to all of you following this meeting.
Awesome, that sounds very exciting.
Hey, I need
All
to
right.
add something here, okay?
Yes, please.
So I have to put it out there and thank Second Harvest. Had a client that went through an emergency gallbladder surgery, and voila, they were able to help me get food for him. And this client has quite a few health disparities to begin with. So my hat's off to them.
That's great. That's good news. I'm glad to hear that. It sounds like we've got the right partner. Okay, ladies and gentlemen, doesn't sound like we've got more to bring to the board meeting this afternoon. I thank you for taking the time today, and I hope you have a nice weekend, and hopefully we'll see some of y'all tomorrow. I'd look for a motion to adjourn.
So motion.
Good.
Ms. Ronnie.
Thanks, Ronnie.
And this is Madeline. I'll second.
Yay. Thanks, Madeline. Everybody have a wonderful, wonderful rest of your week. Thank you very much.
Thank you. Bye.
Thank you.
Bye. Be safe, everyone.
Bye now.